Okay, the webinar will be posted on the Living Well Iowa website when we are finished. I just want to make sure. Yep, I do think that it is recording, so we are good to go there. The livingwelliowa.org website, Maggie posted that in the chat, so that link is available there, and it's also on our resource slide at the end of the presentation. If everybody can put their name, their employer, and your job title in the chat box for us, that would be wonderful. That way we'll have a record of who attended the webinar today. We'll also be emailing out PDF handouts of the presentation, and I believe Maggie will also be posting those in the chat, so you'll have those available there as well. I do ask that you just keep yourself muted as we proceed with the presentation today. At the end, when we're doing the question and answer session, obviously feel free to unmute yourself when we get to that point. Also, at the end of the presentation, we will be sending out a link to an evaluation after the webinar ends. So if you just take a minute to complete that, that would be wonderful. So with that, we are going to get started on our webinar today. I am your presenter. I'm Angela Drent. I'm a health promotion specialist here at Siouxland District Health Department. We are the public health agency that serves residents of Woodbury County, and we are located in Sioux City, Iowa. Today's objectives are going to be to gain an understanding of what the CHII is, be able to identify some locations in your county where you would like to hold or conduct a CHII on-site assessment. And we'll also be learning how to actually implement the assessment and how you can use the information to help you create some policy, system, and environmental change in your area. And why? Why is that important? If you were on our presentation last time, or last webinar last month, you may recognize this slide, but this is why. There are 1 in 5 American adults has some sort of a disability. That's about 20% of our population. And everyone, really, regardless of ability, should have the right to the same physical activity and nutrition opportunities as people without disabilities. So what can we do about that? Well, we can ensure that our communities are inclusive of all individuals, regardless of ability. On the last webinar, you may also recognize this slide, but I had introduced the CDC's Inclusive Health Communities model. And we talked about the commitment phase, which really involved more of that building your coalition step. Today, we're going to be talking a little bit more about the assessment and training phase. And this is where you will train your coalition members and others in your community to help collect data. There are several ways to collect data, which most of you are familiar with. Just general surveys, walk audits, or inclusive walk audits, and of course, CHII assessments, which is what we are going to be spending the majority of our time on today. With the CHII assessments, this information that you collect, you'll be able to actually put into that next phase, which is that prioritization and planning phase. And it's also great information that can be used for your community health needs assessment. And it's just another way to ensure that you're incorporating health equity into that plan. And it also helps ensure that you're going to focus on this segment of the population. So today, as in the title, we're going to be talking about those, the CHII assessments. And there is a video I included in the link with today's presentation called What is the CHII? It's a nice little video on YouTube that was developed. If you hadn't had a chance to watch that, I encourage you to do so after the presentation today. It's just a really nice summary of what the CHII is. So today, The CHII was actually a tool that was developed by NICPAD, and it's really the first instrument to operationalize community health inclusion into a comprehensive assessment tool that can be used to determine what supports are needed to improve healthy active living among people with disabilities. So you may be asking, like, what is this and how do we do this? And what can be CHI'd? So basically there are 3 different types of CHII assessments that are out there. The first one is a macro community assessment. The second is an organizational one. And the third is the on-site assessment. I'm going to briefly just spend a little bit of time kind of going over the first 2, the macro and the organizational, and then we'll spend the majority of the webinar today on the on-site assessment. So macro, meaning big, is really what that is. It's just a big, larger community assessment that will help you get a larger picture of your community. It really looks at things like training for transit staff, subsidies for older adults and persons with disabilities, kind of analyzing where your low income neighborhoods are in your community. It also has you look at policies that are being implemented within your jurisdictions, like snow removal policies, your ADA transition plan, and complete streets policies that might be in place. And it also looks at suggesting that you do some mapping and analyzing data sets so you can really determine geographically areas or neighborhoods that have higher disability rates, their access to transit, physical activity opportunities, and nutrition opportunities. So that's kind of a little summary of the macro community assessment. The second assessment is the organizational assessment. And this is a tool that's really developed and meant to be implemented at the organizational level. So it's those organizations and businesses that take that tool and they assess their own policies. They look at disability awareness, their programs and services. That information you can then review and look at, and it helps you get a better idea of the policies that they may have in place, what types of physical activity and nutrition opportunities they offer the community. And it'll really help you identify what their attitudes are in this particular area. The nice thing about this particular organizational tool too is that it gives those businesses and organizations some ideas on other things that they may want to implement that would improve inclusivity amongst their organization. So this third tool, which is what we're going to spend all of our time on today, is called the on-site assessment. It's the Community Health Inclusion Index on-site assessment. So this tool really determines accessibility inside as well as outside of facility. It analyzes accessibility of programs and services, and it assesses access to inclusive physical activity and nutrition opportunities. We always like to tell people that this is not an ADA compliance check. We're not coming in to do that. We're simply coming in to do a little assessment. It only takes about an hour, and it's really meant to just provide some suggestions on things that they might be able to do to become more inclusive. And what's really worked for us here locally is that we've kind of taken that information from the assessments, kind of summarized it into a results and recommendations document. And then we present that to those businesses, and then they really get to decide what improvements they want to make. It's not us deciding, we're just gathering the information, giving them ideas and suggestions, and then those entities really make those decisions on where they want to go with that information. I would say these on-site assessments really have been a catalyst to change in our community, and really have been extremely helpful in helping us implement some of those PSE changes here locally. So now you might be asking, well, who can administer the CHII, this CHII on-site assessment? Really anybody can do it. It's kind of a grab and go pick up and utilize document. Anybody on your coalition, an advocate, you might involve your local public health, might involve your RPA or MPO. your city ADA coordinator. Some of the larger communities will have an ADA coordinator for the city. And you might even involve somebody for your centers from independent living. I really would recommend getting a couple of people from your coalition who kind of are interested in this and having them be your main community CHII assessment specialists, and then recruiting a couple other people who will assist you in these. We found it best. It's both Dawn and I, Dawn Kimmel from our Simcoe, which is our MPO or RPA. It's her and I are the kind of the main specialists in this. And then we also have a couple other coalition members that have been trained to assist as well. It's more fun if you do it in teams. If there's two of you, it makes it a little easier because somebody might catch one thing and somebody else might see something a tad bit differently. Including somebody with a disability when you do these assessments can be extremely beneficial as well. So we encourage that. We like to set goals for our coalition and to do a certain number of these on-site assessments every year. So once you have that and you know who maybe on your coalition would be interested in implementing these, then we need to make sure that we have the right tools. So what are some of the tools that you may need? Well, they are shown here. You're going to need a tape measure. Just a standard tape measure is going to be fine. Digital levels come in handy for slopes of sidewalks and cross slopes. So we do recommend it a 2-foot digital level, not the 4-foot one. And then a door pressure gauge. That's what the item on the right side of your screen is. That just measures the pressure of like how much pressure it takes to actually open or push open a door or pull open a door. And we'll get into some of those specifics when we get into the tool. So once you have these items ready to go, you can kind of determine where you want to complete the CHII on-site assessments. And these are the locations that you can look at doing them. Schools, work sites, any sort of a healthcare facility, and then community institutions, which could include recreation centers, parks, pools, playgrounds, farmers markets, community gardens, cafeterias, restaurants, really anywhere where there's going to be some physical activity or nutrition related offerings, or any institution really that's looking at trying to be more inclusive. So I'd like to take just a second, if you will, in the chat box. I'm just curious to know if anybody has implemented an on-site assessment before. So if you have, just include that, or if you have no, just a simply no response would be perfectly fine. I'm just kind of curious to see who has any experience with the tool. The other thing I'd like you to just kind of think about, and you don't need to put it in the chat, but just maybe write it down for yourself. When you're looking at these locations, is there any place that comes to mind that you think you would really like to implement these assessments at? So maybe jot just a couple of those down on a sheet of paper near you. So this particular assessment looks at, and it's laid out very easily, several different components. So it's going to look at, like I had mentioned before, outside the facility, things like transit, walking and rolling around the site. You're going to analyze intersections, getting into the site. How easy is that? How accessible is it? Doors, any type of printed information that they have available, or information in general and where that's located. For instance, if it's on their website or just in printed form. It'll look at restrooms. And then it does take a look at, there are certain sections for the items listed on the right side of the slide. So the food, grocery, farmers market, community gardens, locker rooms, exercise facilities, pools, playgrounds, trails, and healthcare venues all have a separate set of questions. So obviously, if you're assessing a facility that doesn't have one of those components, we simply just skip over that portion of the assessment tool. All right, so now that we got that basic information and you kind of know the tools that you're going to need, who can possibly implement it, and where you're going to implement it, Now it's just a matter of doing it. And there's no better way than just kind of diving in. So when you do that and you got the place, you're going to kind of review the assessment tool. I do recommend that you take a lot of notes. So what worked best for us is to actually have a printed copy of the assessment tool, just a hard copy, and we just make notes on that. And we take a lot of photos when we go. It's sometimes easier when you go back and you present the recommendations if you've got photos to be able to share with those entities so they've got a better visual. And then to just practice, it might be just picking that assessment tool up and doing it at your own facility, just to become more familiar with it. So we are going to go ahead and open this up on the NCPAD website. This is the assessment tool. I'm going to enlarge the screen, but we did send this out as well electronically so that you have that. Is the print large enough? If it's not, if somebody just puts a comment in the chat box, I can increase the font of the assessment tool if need be. So with this, you will just fill out this basic information here before you head to the site. So it's just the type of facility it is, the name of the facility, just basic information. It's also helpful if you take a look at where the transit stop is nearby before you go. There's some specific questions about how often that bus or the train come through to that particular stop. So you'll get some of that information you can probably get on, if you've got a city transit, get it right from their website or go ahead and call the office to get that. The facility too might have that information and know as well. So when you get to the second set of transit questions, there's a section that says walking and rolling around the site. So is it safe or possible to walk or roll on the paths around the site? So this is a very subjective piece of information. So you're obviously just going to say yes or no. So you're looking for things like maybe trip hazards, how smooth is the cement? Is it a paved area or is it an unpaved area? Those sorts of things are the things that you're going to be looking around. Is there a sidewalk around the facility? The second question here just says, indicate if the following characteristics that make walking or rolling appealing are present. So you're going to have this buffer between the sidewalk and the street. So the buffer that it's referring to is in this graphic right here, and that would be the grassy area that goes from the sidewalk to the street. That's just kind of a protection measure. It makes pedestrians feel more safe. So that's what that buffer is. It asks about benches and trees and green space and clean and well-maintained sidewalks, paths, and this free of noise pollution. So depending on where you are, you would then just mark each of those areas, none, some, many, or all. So again, like I had said before, it is somewhat subjective for some of these questions. I'm going to skip over some of these. So here is number 17. It says indicate whether the following characteristics are observed on none, some, many, or all parts of the destination. So again, the sidewalk from the transit stop to the parking area, is the sidewalk 5 feet wide? Is it free of obstacles or hazards? It has you take a look at the cross slope of the sidewalk. And then is the sidewalk smooth and firm and not dirt and gravel? You can note any obstacles in there. It gets into the curb cuts as well. So you can see the slope of all curb cuts need to be 8.3% or less. And that's where that digital level that I had mentioned earlier comes into play. You can actually measure the slope and the slope of the curb cuts, the cross slope of the curb cuts, as well as the sidewalks. And there's a good image to kind of help you remember what that cross slope is right here on the assessment tool. So you can see it's kind of just broke out real easy. There's some more descriptions on what the curb cut is, if there's not a curb cut, that detectable warning, which is the ADA pad. We're gonna go over the intersection information, goes over the driving site, parking lot accessibility. It'll have you to kind of take a look at that and whether or not there are accessible spaces with the upright signage, and that upright signage should be at least 60 inches minimum from the ground. The access aisles, you'll want to measure those with that tape measure. Those are supposed to be a minimum of 5 feet wide and adjacent to the accessible parking spaces. And then you'll indicate whether or not they have designated any van accessible parking spots. When you get to the site, you'll just mark if there's any stairs to get to the main entrance. If not, you'll just skip over number 30 and then you go right over there. And so like it said earlier, it's a really easy tool that you can just kind of take and utilize. It'll have you take a look at doors and whether or not there are accessible push button entries or the type of handles that are on the doors with knobs. So turn knobs being less desirable, really anything with a maybe a lever or an opportunity that you can put in a fist, anything that you can operate or maneuver without having to actually grab and twist makes it easier for some individuals with disabilities. You'll measure the opening of doorways to make sure that they're at least a minimum of 32 inches wide. You'll look at the threshold of the doors to make sure that it's less than 1/4 of an inch of a lip. You'll take a look at any of the printed or promotional materials or brochures that they have and whether or not that's available in different formats. And you can see those formats listed on the assessment tool. Large print if pictograms are available on there. Having information on the website is always an easy way to make it more accessible as well. The restrooms, there's a section for restrooms that you'll see on here. I'm going to skip over some of that. There's some lettering, the pictogram, there's a braille, the high contrast lettering is something else that you'll take a look at. And then it breaks it out from there for different types of food venues. So you'll see that if it's a food venue or if it's not. And again, you're looking at some of that printed information. You're going to look at where individuals pick up utensils and whether or not they can easily access that. I'm going to scroll down here real quick. The grocery store section will ask if there's things like adaptive carts, if the prices of foods are displayed in large print and if they're high contrast, if there's a checkout aisle with a designated sign of accessibility. At the farmer's market, you'll look at things like if it's a smooth, firm surface so, that it's located on, not in grass or in gravel, whether or not individuals are able to grab items from the vendor booths, access the vendor booths easily, if there's adaptive carts available, if there's assistance available upon request signage. Community gardens, we'll look at if there's a raised garden bed available, any type of adaptive equipment, if there's low cost or subsidized memberships. Physical activity venues, you'll look at the locker rooms if there's a locker room and whether or not there's obstacles to the lockers, if there's floor space in front of the lockers, if there's locker door handles are supposed to be different. I have a picture of that I can show in a little bit, but the lever to grab and open is slightly different on an accessible locker. So we want to make sure that those facilities have those. It'll look at shower facilities if there's some in there, whether or not there's adaptive equipment that's available. such as the arm ergometer, any types of straps, things for grip strength that you can attach. Pools, it'll look at flotation devices and slip resistant surfaces, zero entry, playgrounds. It goes over a bunch of stuff. The multi-use trail, if it's at least 5 feet wide, free of obstacles, if there's navigational aids and pictograms. The healthcare venues, you'll want to look at things like waiting rooms and whether or not there are 3 feet wide space, if people can easily transfer from a chair onto an exam table, and that kind of gets into this exam room section. Exam room should have adjustable height tables, whether or not there's an accessible chair scale or a wheelchair scale. And that is that. So that kind of gives you just a skimming of what that assessment tool is and some of the questions that are located on that. So I just want to spend a couple of minutes. We're just going to go quickly through a few pictures just to kind of give you an idea. I'm a visual learner, so I find it best to be able to see some of these things and what you might be looking for. So when you're looking at bus stops on the transit exterior, we want to see and analyze if there's shelters, if they have companion seating, a bench seating, if there's a paved sidewalk or path to the transit stop. So those are all things that you would want to also look at, and those details may not be in the CHII, but it's something that you can provide recommendations back to the cities or the entities that you're working with, especially if it's in a high need area or a highly used bus stop. Exterior access, you can see here on the picture, we have a parking lot with accessible signage, with some water there on the ground. Does anybody, if you could just put in your chat box real quick, what's a couple of things that maybe pop out that might not be in compliance with recommendations? Okay, I don't see anybody including anything in the chat box, so I'll just go ahead and, I mean, obviously this is not ideal that there's water kind of pooling right where the parking stalls is, and then these accessible signs are supposed to be at that 60-inch minimum, so they should be not next to the ground. They should be minimum of 60 inches off of the ground so that you can see them when you're pulling up in a vehicle. So the next photo that we have here is a park. And again, I'm wondering if anybody can identify what might be an issue with this particular photo. If anybody has a quick response and wants to put it into the chat box. Otherwise, I will go ahead and move on. Okay, so I'll let you know. So this is a boundless playground. It's one of our barrier-free accessible playgrounds here in Sioux City. And one of our coalition members had brought this particular issue to our attention. She uses a accessible vehicle with a lift in it, and there's no accessible parking here. So what had happened to her one time is she pulled in, was going to go to the park. Somebody parked right next to her. There was no accessible designated parking, and she was not able to leave until the other individual left because somebody parked right next to her where her ramp would need to go down. So this was one thing that we did fix. So here is ideally what we would like it to look like with that van accessible parking, with the signage, the pavement markings, and the sidewalk to the playground being blocked with an access aisle. so that individuals who use mobility devices are now easily able to access that particular park. Building entry can often be difficult for persons with disabilities. A really additional consideration when you're doing these CHII assessments is looking at properly functioning doors. So yes, this has a push button entry, an accessible entrance. And this is not a very good picture of it, but when we were there, you do that. It's a very small 4-foot wide sidewalk with a step down. And this door, when it opens up, blocks that sidewalk. So, and the ramp is over on the left-hand side of the door. So an individual has to go up the ramp, across the sidewalk, be able to push the button and go in. And if there's multiple individuals who utilize mobility devices, they can only go in one at a time. So an easy fix for this would just be to switch the swing or the hinge on the door so that it opened to the opposite direction. So again, it's these little things too that aren't going to be included in the CHII, but it's a quick little easy fix for that facility. Here are a couple of pictures side by sides of some registrations desks. The one on the left has a printer and a box on it, leaving very little counter space. The one on the right has a wide open desk. They both have the roll under surface, so an individual who utilizes a wheelchair is easily able to access that. But just kind of educating the staff and facilities about these lower access points. An easy fix is just to remove the printer and the box, because this really was the only other screening area that had the lower counter for this particular business. The rest of them were raised, taller, bar height almost counters throughout that registration area. Interior door pressure is something else to look at. There's that door pressure gauge being used, and it's just a simple little twist on that mechanic to decrease the pounds of pressure to 5 pounds or less. Here's some photos of locker rooms and bathrooms. So these different height options just make it more inclusive and accessible for individuals who utilize wheelchairs to be able to use the hand soap, the hand dryers, and the lockers that are indicated with the accessible signage. Our farmers market accessible features again are being on a pavement, providing wagons to more easily transport produce, providing assistance available upon request, accessible portable bathrooms and picnic tables, and making sure that tables and tent posts do not block the flow of traffic or prevent somebody from getting into a booth. Cafeterias, we just want to make sure that all of these items are closer to the front and not pushed back, so that individuals can reach those from a seated position. You also want to pay attention to items that are on kind of the top tier of a stackable shelf and making sure that those items are within reach as well. Just a couple of pictures on some more accessible equipment or adaptive equipment, the adaptive climbing wall. Sometimes you have to ask the facilities if they have any types of adaptive equipment because it might not be readily available, easy and out. They might have it on a checkout basis. So you may need to ask about some of those programs and services. Accessible parks. So here was one where we did an assessment. It was at one of our new parks. They had this white barrier that went all the way around the splash pad, which prevented anybody with mobility devices to go in. So a conversation with the city, it was an easy fix. They just removed the white barriers where the sidewalks came in, which allowed access and allowed individuals to be able to turn on the splash, not only get into the splash pad, but also turn the splash pad on. In reviewing the assessment data, you'll just kind of look at those best practices, try to find findings that are inconsistent with the guidelines. Note any type of facility recommendations that might help them become more inclusive. And then we always invite those entities to come to coalition meetings, advocate for community change, any way to get them involved in making your community more inclusive. This is just a little look at some of the items we include on our facility reports. So again, it's just pointing out the good with the best practices. It's taking a look at the findings, so the things that maybe don't quite meet the guidelines or the recommendations, and then identifying ways that they can solve those little issues and make their facility or programs or services more inclusive. So things like just adjusting the interior door pressure to 5 pounds or less. Maybe it might be remodeling a family restroom. You are going to run into challenges when doing this, so expect that. Some challenges are obviously going to be the lack of funding or lack of commitment, different priorities. And you're going to do these CHII assessments, and some entities aren't going to implement anything. And that's okay. When they're ready, it may not be right at that particular time, but maybe in a year or so, after they've had time to process and think and plan, it might be something that they end up doing. So the next steps, just real quick, just kind of going through those steps, is identifying who's going to do the CHII assessments, make sure that you have the tools ready. You're going to do the assessment at the workplace, write up those reports and the findings, and then of course, present those ideas and recommendations to those facilities. Again, here's the links to the assessments, which were included in the chat box that Maggie put in there a little earlier. I've included some of the resources. There's more videos on these particular websites that you may want to take a look at in the future. And so we have about 5 minutes. I'm going to open it up for questions real quick. Questions or comments that anybody has on the CHII on-site assessment.
I can start, Angela. This is Arkan from Blackhawk County Health Department. So the first question I have is, this is mostly the huge infrastructure investment, and most of the buildings are done long time ago. And then, I mean, just like I'm looking for how receptive workplaces, organizations are in terms of remodeling, because it requires a lot of funding and investment on their structure. If there is any good experience that we can learn from, that's one. The other one is there any initiative that work with design? I mean, just like different organizations use different designing agencies to design their buildings. If there is some consideration to integrate this lens of inclusion into the design, or because once it is built, really most agencies are going to be resistant to change anything and invest into that. So that is one. The third one is, if there is, so you talked about community health inclusion index. Is there a way that you calculate the index from your survey? So that it has to be some index, right? If it is an index, it's not just a data collected and you analyze and present the results, but is there a way that you can also calculate the index and say our inclusion index is this level or this % kind of thing? Thank you.
Yep. Okay, so let me start with that first one. I believe your first question was about the funding, like, because there are big changes in how you get, entities involved to commit to that. Again, like I had said before, we just present the ideas to them. We always include some things that are really quick, easy wins. It might be a change in a policy, which isn't going to cost them anything. It might be adjusting the door pressure, which will not cost them anything. So some of the changes are big in change, but small in price. So again, when we present these ideas to them, some of them are going to be quick wins and some of them are going to be more expensive items. So if they can kind of break some of those things down, start small, make some progress, and then start planning for some of the more larger more costly change items down the road, that in itself is a win, right? So if we can get them to start small and plan to do some of the larger items down the road, that's going to be a win. You're going to eventually make some of those small changes, and eventually it'll grow into some of the larger ones. Some of the design changes, making sure that we work with, I've worked with our Parks and Rec. So we've got new parks that are going in. I will ask to see plans, or I work with the city when plans are being approved before they're actually approved. We'll ask to see those, to review those site plans so that we can say, okay, well, we really need to have a sidewalk here. We want to make sure that we've got a crosswalk in the parking lot here. So it's some of those larger community-wide policy change items, if you can get involved that way, will kind of help make some of those larger changes before it's done. So we had a new park that was going in. We did that at Cone Park, reviewed the plans, gave them some ideas and suggestions before it got started. So some of those inclusion pieces were included from the get-go. So it was a forethought, not an afterthought, right? And so that's what we're really working towards, try to get inclusion beyond the ADA at the forefront of everybody's minds. But it can't be just one person. It's got to be a community effort and a coalition effort at a system level to get to that big change. And as far as the data, so when we did this on our large project with NACDD, there was information that you could enter in online, and they gave like this big, more community-wide picture. So that's available when we were doing our project. I can check to see if that's still available. Dawn and I just found it helpful. We're looking at those small PSE changes within the entities that we're working with. We found those to be, I guess, easier to manage. It didn't give us as much as just implementing the assessment and doing it on there. But there is more of that data from that macro level that you can pull.
Thank you.
Okay. Do we have any other questions that are out there? Because we are at 1:46, so if you need to pop off, that's perfectly fine. If not, I'm always willing and open to having conversations. I've included my contact information on the slide as well. I do like to include this particular quote from John with our Parks and Rec. This project literally opened up a new world of opportunity for a significant portion of our city's population, and it created opportunities for people with disabilities to be physically active alongside family and friends. And this is really what it's all about, right? Each of you have the opportunity to kind of bridge that gap, that inclusion gap, that graphic in the beginning, in your communities. So just getting started and keeping inclusion as a forethought rather than an afterthought will help you make some of that change. So again, if this particular site has my contact information, if you've got questions about this assessment tool or any of the information that we've been presenting, feel free to reach out at any point in time. Okay. All right, well, I thank you again. We'll be sending out an evaluation at the conclusion of the webinar here in just a tad bit with some of the other information and handout. So thank you for your time today. I do appreciate it. Everybody have a good afternoon.